problem.
Goodbye, guys.
All right, we'll get started in just a moment or two. All right. Hello, viewers. Thank you so much for joining our prenatal, postnatal Facebook Live series. My name is Andrea, and I'm a health promoter with Family Health here at Niagara Region Public Health, and I will be the host of today's live event. Today, we'll be taking the time to talk about postpartum mood changes. Before we begin, I would like to give a land acknowledgement. We would like to acknowledge the land on which we are hosting this webinar is the traditional territory of the Haudenosaunee and Anishinaabe people, many of whom continue to live and work here today. This territory is covered by the Dish with One Spoon Wampum and the Two-Row Wampum Agreements. These agreements establish relationships between nations for harmonious coexistence based on respect, kindness, and acceptance, and stewardship of the land and resources to ensure that all people benefit and thrive. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples. Acknowledging this reminds us that our great standard of living in Niagara is directly related to the resources and friendships of the Indigenous people. I have with me here today Rosemary, who is one of our fabulous public health nurses in the Reproductive and Child Health Department. Rosemary, could you tell me a little bit more about your professional background and current role?
Sure. Thanks, Andrea, for having me today and to talk about this topic. As we know, May is Maternal Mental Health Awareness Month, and today is also World Mental Health Day, World Maternal Mental Health Day. So again, thank you for hosting this live and for inviting me on. And like you mentioned, I'm a public health nurse in the Reproductive and Child Health Program. I've been a registered nurse for 6 years and have always had an interest in supporting women, pregnant people, and young families.
Thank you so much for being here with me today. Before I get started, I would like to go over a few just ground rules and reminders. To all of our viewers watching today, if you have absolutely any questions throughout the live, you are welcome to put them in the chat and they'll be passed on to our presenter, Rosemary. Also, if we are unable to answer any of your questions today, you are welcome to reach out to us. Niagara Parents is available to answer any questions by phone, by live chat, or simply by sending us a Facebook message. This live will be recorded and will be available for later viewing on our Facebook and YouTube channel. And we will also share tons of links and resources that may be mentioned throughout the live in the comment section. So keep an eye out there and be sure to click any links that are relevant to you. All right, without further ado, let's get started. We have a bunch of questions to get into today. So we're going to kickstart it with asking Rosemary a little bit about postpartum mood changes and what you've seen really with parent experience.
Sure, thanks, Andrea. So I'm going to put up this slide here. And it talks about, well, it shows that there's a few different things that parents can experience. Undoubtedly, it's a huge transition in people's lives when they welcome a life into the world. So there's a lot of different things you can expect. And these are just some of the things that we've seen. So baby blues, postpartum mood and anxiety disorders, and psychosis are three categories that we'll hit today.
Awesome. So a question we hear a lot from parents, and I know you have it up on the slide here, is surrounding baby blues. Could you explain a little bit more about what that is?
Yeah, so baby blues typically happens within the first 3 to 5 days following the birth of a baby. And it usually lasts around 1 to 2 weeks and resolves kind of on its own. And it can be as common as in 4 and 5 mothers that experience the baby blues. So what it is that it's related to rapid changes in hormone levels after the delivery. And I think too, lack of sleep in the beginning when you're just getting used to, the schedule of a newborn can also contribute. What it's not is it's not mild depression or part of the perinatal mood disorder spectrum. It's not related to life stressors or mental health history. And it doesn't impair your ability to take care of your baby or themselves or yourself.
Awesome. So we know that baby blues can occur in the first 2 weeks following delivery of a new baby. So what is postpartum mood disorder or PPMD?
Yeah, so PPMD really kind of happens around the 4 to 6 week mark following the birth of a baby, but it can start really at any time in the first year to 18 months following the delivery. It is considered one of the major type of depressive disorders, and the symptoms vary from person to person, and it's as common as 1 in 5 moms experience it. But even given the pandemic and COVID, I would say it's more like 1 in 3 even. So it's pretty common.
Right. Thank you for sharing that. What is postpartum psychosis and how would an individual know if they had that or not?
Yeah, so postpartum psychosis is very rare, but it's a very serious illness with risks to both mom and baby. So, a mom could be experiencing things like having very strong thoughts of harming themselves or harming their baby, hearing or seeing things that are not there, believing that people or things might harm you or your baby. So, having a very strong feeling of not being safe, feeling confused or out of touch with reality potentially, and that could involve having a fixation on something else, on anything else in your environment that is not associated with the baby that prevents you from meeting your baby's needs and even your own physical needs as well. So to learn more about psychosis, we actually have an awesome video that was created by our mental health department about how to identify psychosis in individuals. So we'll link that below because it goes into a lot more detail into the chat or the comment section.
Amazing.
So I'm just going to go into some symptoms here because we talked about what the 3 things are, and I know that we highlighted that psychosis has some a little bit more specific symptoms, but like we said, the symptoms vary from person to person. And on this slide, my colleague Audrey and I have put together this slide, basing it on the symptoms that can influence our moods, our thoughts, and our behaviors. Because all these 3 things have an interplay and how they impact mental health. So the potential moods that you might experience or a mom might experience with postpartum or even baby blues are sadness, loss of interest in things that they enjoy, feeling lots of feelings of guilt, mood swings, edginess or anxiousness, hopelessness, feeling depressed or down, feeling overwhelmed, and feeling like you can't cope, or maybe even having fear of being alone with the baby. Some of the thoughts you might experience could be low self-esteem, self-image, self-doubt, difficulty attaching to the baby or feeling attached to your baby, difficulty concentrating or unable to focus, a difficulty in making decisions, having a lot of worrying thoughts, or scary or intrusive thoughts, and suicidal thoughts with or without a plan for that part. And behaviors could be changes in your appetite, either eating a lot more or eating a lot less, changes in physical appearance and hygiene practices, tearfulness or crying, disturbed sleep patterns, difficulty sleeping or sleeping all the time. It is difficult with a newborn, but even when your baby's settled, you might find it hard to settle yourself so that you can actually rest while your baby's resting. Having low energy or feeling exhausted all the time, avoiding social situations like isolating yourselves or shutting the blinds to keep a distance from others, not doing the things that you actually enjoy, having a flat affect, which means you're not really you don't have a lot of emotion on your face, which you could either miss your baby's cues or having that flat affect can make it hard for your baby to interact with you as well as a parent, and missing work or appointments or putting things off that you need to get done. So if you think that anyone watching, if you think that you or someone you love might be experiencing intense emotions and is struggling to cope or is in a crisis, it's important to get help right away. So you can go to the ER or call a crisis intervention line. We have the number there for Coast and distress centers in Niagara. So jot it down, take a picture on your phone, or we'll also link it into I'm sure we'll link it into the comment section as well. So, that can be a really good place to start for, if things are really bad, to get help in creating a safety plan for you and your loved one and a baby.
Thank you so much for going through those symptoms and really showing how those are some things to look out for when potentially experiencing any of these disorders of any kind. With that being said, a lot of questions we get are about if there's any contributing factors to developing PPMD. So I thought you could go into a little bit about that.
Yeah, of course. A lot of people want to know what might predispose them or might put them at risk of developing postpartum. So life stressors is a huge one. A history of mental health challenges throughout your life, or even having a family history of someone that's had mental challenges, especially during the perinatal period. Feeling anxious or depressed starting in your pregnancy. Having a lack of social support, experiencing low self-esteem. If you've experienced abuse, trauma, or grief, substance use, the pregnancy is unplanned, that can be a big change for people, and or unwanted as defined by the mother. Unresolved challenges also with infant feeding. So if you're, having a hard time with feeding your infant, it can really contribute to the development of postpartum. That could include a lack of social support by healthcare providers even. So, we at Niagara Parents, we provide access to a specific level of support through our infant feeding team for any parents that are struggling with feeding their infants, because we know that it can contribute to a lot of mental health struggles trying to get your baby fed, for sure. It's a huge stressor for parents.
Okay, all right. Are partners at risk for developing PPMD as well?
Yeah, partners are at risk. So, anyone who is helping take care of the baby, whether it be a co-parent, someone who identifies as a father, anyone who is helping care for the baby is also at risk. And, the risk factors for them could be also they have hormonal changes. And yes, dads do have hormonal changes when babies are born, like changes in their testosterone, as well as cortisol, which is their stress hormone. Having a lack of support themselves, very stressed about becoming a parent, that can be a risk factor to partners. And also feeling left out of the infant and maternal bonding that goes on, that can be a risk factor as well.
How would you recommend partners kind of support each other throughout this process and with all of the changes?
Yeah, that's a great question, because really it goes both ways, right? Given that information, that I think up to 1 in 10 fathers have been seen to experience PPMD. So, this is a difficult lifetime transition, right? So expect it to be hard, and expect it to be hard on your relationship at times. So some of the things I would say are to listen to and support each other. You can do that by planning frequent mental health check-ins and then allowing your partner to actually tell you how they feel and respond to them in a calm way. Eliminate being overly critical or judgmental of your partners, because you're both learning and adapting to a new normal. So giving each other the chance to, trial and error and learn. I think it's important to also encourage each other to seek support from an outside source. So that could be like counseling or public health nurses or home visiting nurses. Partners can take on responsibilities that are unique to them, that give you the opportunity to develop a strong bond with your baby. And that could be as simple as diapering. I know that there are some resources that we have at the region that we can give to parents about how to increase their bonding through simple tasks like diapering and things like that. So give us a call if you're wondering. I would also recommend that you allow the other partner to take a break, a rest, or even just a change of scenery. Like if you've been at work all day, your partner's been home with the baby all day, they might just need a change of scenery. So even though you've both been busy, they've been in that environment for a long amount of time. So some families find it helpful to take shifts, so that each person has a dedicated amount of time that they can do something for themselves. And so if you do decide to split some time up in shifts, I recommend that you plan ahead and think about what are some things that you enjoy that truly bring you joy, or something small and simple that could help you have a sense of accomplishment in that break. So either if you've prioritizing rest as well, especially in the newborn period, but if you get the chance to do something that you enjoy or something that gives you a sense of accomplishment, it can be really hard to feel good if we're not getting an opportunity for those things. And also finding someone that you trust. It could be outside of your relationship, who you can actually talk to about your feelings and emotions. Having a friend that you rely on, a family member, somebody else that you can actually talk to is also helpful as well.
All right, great. Thank you so much. The next question is just about how has the pandemic affected parents and parenting?
Yeah, I think I can even speak from personal experience that going through the pandemic as a parent has been really hard at times. And, parenting in and of itself, especially like if you're becoming a first-time parent, it can be really isolating at first. And then adding on the layer of a pandemic in terms of isolation as well. And, we weren't meant to do these things alone. They always say it takes a village. So I can definitely say that I'm sure it's been hard for many parents. And there have been studies coming out now that have shown that there has been a significant increase in psychological distress among pregnant women during the pandemic, especially in terms of depressive and anxiety symptoms. And I think just too, in terms of Niagara Parents, we've definitely experienced more calls related to perinatal mental health. And, so we definitely have the skills and the resources to support if you feel like you need to call us. Because we've been through it there with a lot of parents. And we also have a video that we're gonna add into the comments about parenting during a pandemic, which might help shine some light on some things that we can do for ourselves as parents, navigating parenting during these unprecedented times.
All right. Just to remind all of our viewers, we are accepting questions, so please feel free to put those questions in the chat. We did get some questions ahead of time as well. So the next question was submitted by a viewer. The question is, I don't feel the same attachment to my baby that others feel. Is there something wrong with me?
Yeah, I want to say thank you for asking this question. It can't be an easy one to ask, and probably is one that a lot of other parents feel. And I can't even, it's even just as difficult to experience that. But, you and your baby deserve that loving attachment, and mothers who experience postpartum or PPMD may have trouble developing a strong and secure attachment with their baby. So, definitely we're here to help if that's how you're feeling. We have our home visiting nurses who can help with, looking at how things are going with attachment, or getting you some supports for your mental health. And in the parenting during a pandemic video, you can learn a lot more about attachment at around the 16-minute mark. The nurses really give a great explanation about why it's important, and how you can help foster a strong attachment with your baby.
Great. We have another question from a viewer, just asking about, if I'm feeling this way, how can I seek support without feeling embarrassed?
Yeah, so I'm just going to switch to this slide here. So basically, we would love to help you. So definitely reach out to Niagara Parents in a way that feels comfortable for you. So, we have live chat, Facebook Messenger, you can call us on the phone. We have a virtual call option. And, just to let you know that you're not alone and it's okay to ask for help. The other thing too with postpartum is we saw that there was people that might have experienced guilt. You're not a bad parent if you're struggling in this time. You're not a bad person, and you deserve to feel better. And delaying help, might actually delay your recovery and the time that you get to actually enjoy these moments with your baby. So definitely, if you're noticing anything, reach out early. And, feeling depressed or anxious or angry is not a sign of weakness. It's definitely a sign that you've been strong for too long. So, you may want to talk to your partner, family, or a trusted friend, healthcare provider to get the ball rolling, or get in touch with us at Niagara Parents. We can help you find counseling or support groups, and things like that. So you may even want to consider medication if it comes to that. So that'd be a conversation that you'd have with your healthcare provider, who can provide medications that are safe to use while breastfeeding, if that's your case.
Awesome. Okay, we have another question here. I feel like I have so little me time with a newborn. Are there ways to integrate self-care gradually?
Yeah. So, really it could be as little as 5 minutes a day, finding something that really replenishes you, that's easy to do, that's accessible, that you can bring anywhere. And a lot of times, we like to do breathing exercises. Niagara Parents does have, a lot of times we can email you things that you can do in the moment that don't require anything other than your time for yourself. So breathing exercises, stretching exercises, affirmations that you read to yourself, playing yourself your favorite song, anything like that that you can squeeze into your day. And at that, maybe it's reaching on some of your supports that you haven't reached out to yet, and exploring some of those options to see if there's any way that you can get a couple more minutes to yourself during the day.
Awesome. Slowly, baby steps and integrating some kind of
Yep.
self-care is beneficial, no matter
Yep.
5 minutes or 10.
Exactly.
Awesome. All right. One last question. And you've addressed it a little bit, but maybe we can talk a little bit more about what the experience is like when you reach out to us on Niagara Parents.
Yeah. So if you do decide to reach out to us, again, we always endeavor to meet you where you're at. So if you're more comfortable speaking through live chat, we really try to keep you there, so that you can receive the information in a way that you feel comfortable. Or if you like talking on the phone, or halfway in between live chat, you decide you want to chat on the phone, we can definitely arrange any of that. So what it looks like is we kind of, start with assessing how things are going, getting to know what your life is like home with your baby, what your supports look like. And then we might ask you how your mood has been doing in the last 7 days. We have a little questionnaire that we ask called the Edinburgh Postnatal Depression Scale, to see if there are any signs of postpartum that have been occurring for you in the last 7 days. And then if there are signs, we can also fax that over to your family doctor to get them in the loop, so that they can kind of be part of the plan of care. Then we also kind of, looking at what your life is like, we kind of go through with you to help establish or bolster your circle of support. And we also provide you with health teaching, links to classes, anything that might help you reach your goal as a parent and build on the skills that you already have. We talk a lot about nests, which is more into that self-care, which is that nutrition, exercise, sleep, time for self, and support. So we really help you kind of identify those as priorities for parental health, and ways that we can help you. It's kind of hard to exercise if you don't have time for self, and it's kind of hard to have time for yourself if you don't have a lot of support. So we can definitely problem solve with you, depending on whatever it is in your life that you feel like you want to prioritize at that time. And then we also have a postpartum CBT group that you may be eligible for. And that is something where I was talking about the moods, the behaviors, and the thoughts that we might experience in terms of our symptoms. And CBT really aims to improve our mood by giving us tools to reframe our thoughts, or to even change our behaviors so that we have so that we can improve our mood. So it's a great program to look into as well. And even if it's not through our postpartum group, there's lots of ways you can access CBT, be it online modules or through counseling, etc. So we can definitely get you in touch with the best thing for your needs at the time.
Great. We actually had one more question come in while you were explaining the process of Niagara Parents.
Sure.
And that was just, how do you get a home visiting nurse?
Yeah, that's an awesome question. So really, you just reach out to us at Niagara Parents, and you can self-refer. So we can do the questionnaire with you that, we'll go over what your life looks like right now. We book the home visit with you at the time of the call so that we can book you in with your nurse. And then, they come out to see you. Usually within a week or so of you calling, you have your home visit booked and the nurse can come and see you. So yeah, we handle all that on Niagara Parents, and you just reach out to us and we're ready to help you with that.
Sounds like Niagara Parents is a one-stop shop for all of the referrals, supports, and programs. So definitely encourage you all to reach out.
I'd say so. Yeah, for sure.
Awesome. Well, that's it for today. I wanted to say thank you so much again to Rosemary and to all of our viewers who came out today. We'd also like to put out a special thank you to one of our nurses, Audrey, who unfortunately couldn't be here today, but put a lot of value forward with her research and work into the presentation. So thank you so much, Rosemary and Audrey. If you were unable to get to your question today, or you have another question that comes up later on this evening, please feel free to still reach out to us and send us a message on Niagara Parents, or give us a call, or send us a live chat. Our nurses are always happy to reach out and answer any of the questions that you have. In addition, we have another prenatal and postnatal Facebook Live event coming up, with our next one being on Tuesday, May 10th at 7 p.m. So this one, we'll be talking a little bit more about normalizing newborn sleep. So I encourage you all to tune in, and thank you once again. Have a great day, everyone.
Thanks, Andrea. Thanks everyone for tuning in.
Bye.
Bye.